Hi, I'm Janaki and I'm a psychiatrist in Chennai.
So today we are doing the third myth in our series for Mental Health Awareness Week. And today we are going to discuss the myth that when a patient goes to a psychiatrist, they feel that they will be given medication to put them to sleep. They will become like a zombie and will not be able to do anything else.
So just like with all other, doctors and all other illnesses that you go to a doctor for, the psychiatrist will first diagnose you, like we talked about in the last video. There'll be an assessment that is done. And depending on the type of illness, like for example, in psychiatry, we have different types of illnesses. We have depression, anxiety, obsessive compulsive disorder, bipolar disorder, psychosis, schizophrenia. Then we have addictions, we have personality disorder. So, and many, many more. So based on the type of illness, the type of medication will be different. So it's not one type of medication for every illness.
Yeah. So some of the illness, what happens is a person may not be able to sleep well. In that case, a sleeping medication may be prescribed so that the person gets rest and so that the person is able to sleep. So that doesn't mean that we want to continue the sleep medication for a continuous long period of time. So basically, what a psychiatrist wants is that we need to diagnose what condition you have, treat you appropriately with that medication. The different disorders that Dr. Janaki discussed, every disorder has different medication that we can give and different doses of medication that we can give. Find out which medicine suits you best, at which dose it suits you best, and then depending on your response, decide or your body's response, decide how much time we need to continue that medication. So it is not a hard and fast rule. It is a very flexible schedule, seeing what works for you. And then depending on your feedback, we do make changes as required. So this is what is important to remember.
Yeah. And in every video, I've tried to compare what physicians do versus what psychiatrists do.
Yeah.
One very important comparison here is that when you go to a physician, okay, they will be giving you disease modifying medications, and they'll also be giving you medications for the symptoms. So like that, a psychiatrist will also treat you the same way. There will be medications which can actually modify the disease. Like for example, depression, in many cases it can be cured, and obsessive compulsive disorder also resolves in many cases. So there are many diseases which will resolve completely with a course of medication. So there will be one type of medication which will have to be continued for the whole duration of the course, whereas there will be other medications like Dr. Siddhika mentioned, for the sleep, which for the first 10-15 days or for the first month you will have to continue, and after that they will be stopped. So the other medications are just supportive in treatment, whereas there will be one or two core medications.
Hope this helps. See you